Curcumin supplementation in the nutritional management of cancer patients and also cancer survivors. Hi, I'm Dr. James Machino. There are many natural agents that are touted for being really, anti-cancer, certain herbs and supplements and so on. And they've been shown to be effective in animal studies, but very few have been tested in human clinical trials. One of the exceptions is the herb curcumin, which is found in the spice turmeric. It has been tested. It's been tested because it has shown such impressive properties in experimental and animal studies that they really had no choice but to test it. So the modes through which curcumin was shown to block cancer, the spread of cancer and its progression, is by toning down receptors on the cancer cell surface. Many cancer cells have these, they're called epidermal growth factor receptors. They have often, in 40% of breast cancer, for instance, there's too many of these receptors. And so these receptors tend to cause the cell to divide faster and faster. If you can silence them, then the cell slows down its rate of cell division. It allows the other cancer therapies to be more effective. So curcumin is one of the things that's been shown to sort of help silence those epidermal growth factor receptors, very common in breast cancer, prostate cancer, colon cancer. Curcumin also blocks the buildup of a hormone called prostaglandin series 2. And cancer cells like to make prostaglandin series 2. It helps them keep dividing. If you can block the formation of prostaglandin series 2, then you slow down the rate at which the cancer cell can divide. The other therapies will be more effective. This is one of the ways that aspirin has been shown to reduce risk of cancer. You probably have read articles like that, by blocking a particular enzyme called cyclooxygenase. Curcumin does the same thing without causing gastrointestinal ulceration and bleeding, without damaging the liver and the kidneys, as too many aspirins would be inclined to do. The other thing is that curcumin blocks another enzyme that cancer cells use. It's called the lipoxygenase enzyme. We just call it LOX. But cancer cells take a certain fat and convert it into these hormones called leukotriene A2 and leukotriene B4. And they cause the cancer cell to divide very rapidly. By blocking that lipoxygenase enzyme, you stop the cancer cell from getting the traction that it would like to have. Curcumin's also been shown to block the ability of tumor cells to form new blood vessels to feed themselves. If you can restrict their blood flow, then the rate at which the tumor is going to grow is going to be much slower because it can't get the nutrients it needs for many cells to proliferate. And also, it's harder for the cancer cells to spread to other parts of the body if you cut off the blood supply. And by inhibiting a chemical called nuclear factor kappa beta, it also inhibits the cancer cell from dividing. So these are, you can't make a drug that does all of these things at one time, especially one that's non-toxic. So they tested curcumin in a really hard clinical trial. They took patients that have a condition called FAP, where they genetically make hundreds of polyps every 6 months are found in the large colon, and if you just leave them there, eventually some of them will become malignant. The person will have a malignant colon cancer. So they have to go in every 6 months and remove them, or do a colostomy, remove the colon. But even then, there's a remnant part of the colon that gets left behind, and polyps still grow there. So they still have to go in and remove them. And the reason those polyps are growing is that genetically, those cells have way too many epidermal growth factor receptors, which I talked about earlier. So they said, well, if curcumin can silence the epidermal growth factor receptor and actually do it in humans, this would be a great place to test it. So they tested it in patients that had this problem. And they showed that it decreased the number of polyps by more than 60%, and it shrunk the size of the polyps that were growing by more than 60% compared to the group that didn't get the curcumin supplementation. There are no drugs that can do that yet. And because many of us are walking around probably genetically prone to cancer because we make too many epidermal growth factor receptors, it's a good idea for everybody to try to have foods and supplements, I believe, that help to silence that particular receptor. So as the director of nutritional therapy at the Canadian Cancer Immunotherapy Clinic, which is an integrative cancer center, it's spearheaded by a medical doctor who I have great respect for, I provide the adjunct of nutritional management to cancer patients who want that nutrition consultation. One of the supplements that I really encourage patients to take, and there's about 10 different supplements in total, but one of them has curcumin in it, in addition to other natural anti-inflammatories like white willow bark extract, boswellia, and ginger, because all of them have anti-cancer properties. Now, Each capsule of that supplement has 190 milligrams of curcumin. So I'm having the person take 3 capsules at least 3 times a day to get them into the 1,700 milligram range of curcumin. That's the dosage you're going to need to make it an effective therapeutic nutrient if you're fighting cancer, if you want to reduce the recurrence of cancer. So the dosage has to be right. Again, I like it to be in a combination supplement: curcumin, boswellia, white willow bark extract, and ginger, because they work synergistically to produce an incredible anti-inflammatory effect, and you get the anti-cancer benefits of some of what those nutrients are able to do as well. To understand this better, click on the link below. You can read my articles on curcumin and cancer. All the scientific references are there, so you'll know you're getting only evidence-based information from me. And remember that at machinohealth.com you can see my other research review papers, footage from my live professional seminars, other videos, resources, downloads I've created. They're all there to help you lead a long, healthy, functional life, and they're free. All the research review papers that I have, all my teaching materials have all the scientific references in them, so you'll know you're getting only sound scientific information from me on any health topic that you're looking for. So you should make machinohealth.com an ongoing, reliable resource of health and wellness information for both you and your family. Thanks so much for watching.